This video will help you decide if the NUTRIPATH microbiome stool test is legit. Is it worth it? I'm going to dig into that specific test and cover a little bit about NUTRIPATH. So let's get into it. So people like yourself probably want to do this test because you've got gut issues, you've got major fatigue, you might have skin issues, something going on, because we all know the gut is the second brain, and when there's stuff going on with the gut, there's probably other stuff going on as well. So the gut microbiome test can help those things. I ask some of my patients to do this test when things are really chronic, money's not an issue, and they really want to dig into every avenue possible. Like they might have constant constipation or diarrhea, and they want to see the big picture of the gut and how it's impacting that. So whether you've got skin, mood issues, anxiety, low mood, or actual gut issues like bloating, it might be helpful for you. Let's get started. In this video, I'm going to cover 4 different areas. First of all, I'm going to give you my clinical experience in clinic with patients. Next, I'm going to talk a bit about NUTRIPATH and this specific test to see, is it a scam or is it really worth it? Then I'm going to go over this test and show you how it differs from a GP test. And then last of all, I'm going to talk about some real key take-homes without even doing this test, what I would tell patients to do if they can't afford it, or other things that might help them without doing the test. So firstly, let me tell you about my clinical experience. I've been working over 20 years now with patients. I use a wide range of functional tests like this microbiome test, and I've used around 15 different ones and seen 15 different ones around the world. So NUTRIPATH is one brand, but there's some in the US, there's some in the UK. But I've seen some really dodgy ones, and they're just charts with colors and no numbers really. But you've been asked to do this test, and you might think $400, that's a lot of money, is it really worth it? So that's what this video is about. In clinical practice, some patients, money is not an issue, so then sure, do a lot of different tests. But if you are thinking about specifically what's the best way to maximize my money, then $400 price tag. After this video, you can decide, is it really worth it? The differences between it and a doctor's test is obviously time frame. Doctor's test is 1 to 3 days. This test is a lot longer, 2 to 4 weeks generally for the turnaround. Cost-wise, doctor's test is generally covered by GP Medicare in Australia, other countries different cases as well, whereas a functional test, that $400 price tag, it's not covered and the patient will have to pay for that. Other things with the differences between the test is the GP one is really looking at just parasites, specific infections, whereas the microbiome mapping is looking at an array of markers and interconnecting them to see all different organisms, not just pathogenic ones or ones that cause disease, but also beneficial ones and certain inflammatory markers, and giving a lot of information to make a plan for that person. Doctor's stool test is called a parasitology test, and it's usually when there's an infection and patient, for example, went to Bali or they went to a restaurant and they ate something bad and then they got diarrhea or they got stomach pain, they might have been vomiting, and it's an acute thing where the patient says, something's going on, I went to this country and I got sick, and the doctor wants to see straight away, is there something like salmonella or is there a specific parasite? It's very limited, and there's certain parasites and pathogenic bacteria like salmonella which can cause those symptoms, and then they're seeing what exactly it is and then giving the antibiotic to address that. Whereas the microbiome test is looking, as I said, at an array. It includes those pathogenic organisms, but it also includes opportunistic bacteria, so things that are considered not disease but they cause bloating and gas and those symptoms. At this point, comment below if you've had these experiences, you've traveled to Bali or another country and you've had these issues. Comment below. Tell me your experience. I love to read and comment and answer those and address those, and they'll help other people as well. So now let's talk about NUTRIPATH. So it was founded in 2011 in Australia. They've been around a very long time and they're based in Melbourne. Their tests are offered globally. They're a pretty big organisation, a lot of staff. You can get some of their tests in the UK now and Japan and other countries. They're under the body of accreditation and regulation in Australia, so they are very legit. In this specific test, they use quantitative polymerase chain reactive testing techniques. This is the qPCR, and they're looking at the DNA fragments of the particular organisms, and then this is what they're reporting on. They also use some culture techniques, whereas the GP test is looking more at specific visual, and they do use some PCR. Now let's get into a test now. I'll show you on my screen quickly the test and we'll run through it and see what you get. Complete microbiome mapping test. It's a sample one, but it gives us a real insight to what they're offering for that $400 price tag, Australian dollars. So this is what you would get. First of all, macroscopic description is just, how does it look? See their acute blood. It's really handy to know. So a general doctor one will just check for parasites and bacteria, not considering blood, but if you see a positive here, is it autoimmunity? Is it cancer? Could this be an underlying reason for your fatigue, chronic fatigue? So really good information, additional information. Short chain fatty acids, these are just about the repair of the bowel. We've got different markers, GI markers like calprotectin, inflammation. We've got leaky gut, zonulin. We've got fats and things. Now, with the parasites, bacteria, and mycology, we're looking at a lot broader organisms. So we're not just looking at the pathogenic main ones like salmonella or worms that you can see in your stool. We're looking at opportunistic bacteria too. Difference between worms and parasites. Now there's a lot of talk in 2025 of parasites and fenbendazole and ivermectin. Parasites aren't just worms that we see in the stool. They're all through the body, they're in the bowel, they're amoebas, they're single cell organisms, but they also can be worms that can be visually seen, but there's also worms that can't be seen as well. Digging a little deeper into what type, and even ones that we can't test in this test could potentially be an issue too in the bowel. Now onto opportunistic bacteria. They're not tested in a general bowel test screen, but these organisms cause fatigue, chronic fatigue, autoimmunity, bloating, skin issues, and things like streptococcus. You may have heard strep throat. This is common in children and adults when you get sick, run down, sore throat, white. This is called strep throat. It can live here, but it can also live in the digestive system, and it feeds on your dietary intake of sugars especially and carbohydrates. But these organisms are important to test, especially connected to autoimmune triggers. We've got Candida and other fungal species and families, a lot of different types of Candida, therefore targeting them with different antimicrobial agents. And we've got the pathogens. So a lot of pathogens are tested in the standard doctor test, like E. coli and Salmonella, but not detailed Helicobacter, which causes stomach ulcers. Only a basic screen, not the gene makeup of that, not the virulence, how strong it is and how difficult it is to eradicate. A lot of detail here, as you can see. Viruses, then beneficial bacteria. Now I've seen some test labs from different places. I won't say which ones, but they're often on discount sites, or they're self-home test kits, or they're on special Groupons where you can get discounts. They come I've seen the reports, they're not actually listing the organisms, the number of them. They're very vague and they just give you a positive or a negative. Be very wary. This test, you can see, is extremely scientific. It is done in a lab with the PCR and the gene sequencing, and it's giving you specific organism count numbers and genus and species of organisms. So extremely accurate, gives you a very detailed report of what to do, and guiding the practitioner and yourself with your specific stool results. Now that was the NUTRIPATH report, and it is recommended that you find a practitioner to go through this with you. You can see there's so much information in there. By all means, you can find information on the internet to try and work it out, but it's just like servicing your car. You can do an oil change in your driveway, you can get the filter and the oil. You could do an alright job, but going to a repair clinic with experienced mechanics, they're going to do a far better job, and it's going to be faster and it's going to be better for the car as well. So it's exactly the same with this test, but I understand you may be trying to save money. So let's get into some practical tips of how to save money. If you think, this test, it's great, but how can I afford $400? So my clinical practice, I often have patients that say this, I can't afford to do that. That's fine. I definitely don't want to pressure patients to do a test if they can't afford it. I just direct them to say, well, how about you spend some of this money or something that you can afford on guidance or medicine. So using it in a different way. So save your money on the test, but use it on targeting your gut health and getting that specific advice of getting your gut right. Because if you find a practitioner with a lot of experience, they've seen hundreds or thousands of patients, and they really should know what's going to happen in certain situations. And through good case taking and listening to you, they should really be able to work out, it's probably bacteria, it's probably fungus, XYZ will work. If you can do that, that's what I would recommend. If you can't even do that, I would start with the naturopathic philosophy on gut, and that's the weed, feed, and seed protocol. Weeding is removal with some herbs and antimicrobials. Weed feed is nourishing the gut and repairing it, and seed is putting back in the bacteria with fermented food and even strain-specific probiotics. This NUTRIPATH test is a winner if you can afford it. Carry on through and watch this video now to carry on with things that can help your health naturally.